Hello, my name is Mahalit Double. I'm from Respiratory Therapy Department. Today I'm demonstrating how to do tracheostomy care. Before I go ahead and start the procedure, I have to go ahead and evaluate the indications for patient distress, tachycardia, and how much or how small or how large the secretion is. Now go ahead and review the charts for the doctor's order and how long the trach has been changed. And I'll go ahead and gather my equipment. I have my tracheostomy care kit, which is sterile inside, and I have my disposable glove right here. I have my sterile water and my hydrogen peroxide, and I have my sectioning kit just in case I need it, and I have manual resuscitation materials like the mask and the oxygen source. And before I put the glove on, I'll go ahead and apply 3 milliliters of alcohol on my hand for 15 seconds and rub it in until it gets dry. And I'll go ahead and introduce myself to the patients and explain the risk and the procedures, and also go ahead and confirm the family members if there is any in the room, and also tell the patients what the complication would be, like bleeding, infection, and misplacing of the cannula. And then I'll go ahead and put the gloves on, which is this disposable glove. Just want to make sure I didn't touch the outside part, just to make sure to keep everything clean around. Okay. Okay, I have my disposable glove on, and I go ahead and open my kit right here, tracheostomy kit. Okay, what I have is I have this, and place it on the side. This is all sterile, so make sure I didn't touch the inside part because I'm placing my sterile equipment on the top. Okay, and next open this kit for sterile glove, and we can place it on the patient's chest. Also, we can also use this to keep everything clean around here. So, okay, then I'll go ahead and put my equipment, which is sterile. I make sure I didn't touch the inside part. Okay, now I have this box, and I'll go ahead and put my, before I put the sterile glove on, I'll go ahead and put my hydrogen peroxide and my sterile water for right here. Okay, then I'll go ahead and put my sterile glove on. Before I do the sterile glove on, I can go ahead and untie the tie, which is around the trach. Okay, next I'll go ahead and put the sterile glove on. Make sure I use the sterile techniques, that I didn't touch the inside part. And this is sterile now. Get the inside part. Now, okay. Now I have my sterile glove on. Okay. Then I'll go ahead and hold the trach and remove the 4x4 glove and dispose it. And I'll take my Q-tips and place it in hydrogen peroxide and clean around the stoma, inside and out. Make sure I clean it very well, and if there's any excessive secretion, I can use a 2x2 glove to clean it around. Okay, then I'll take then before I take the inner cannula out, I'll go ahead and apply antibacterial or antifungi around the stoma. And then I'll go ahead and remove the inner cannula and place it in hydrogen peroxide. Then go ahead and do this. And then I'll go ahead and clean the inner cannula with the brush, inside and out, just to make sure everything is clean around here, and place it in sterile water. We have to make sure all the time before we place the inner cannula back in, we have to rinse it with sterile water. And I'll go ahead and put the inner cannula back into the trach, and I place it and make sure I hear the click sound and make sure that tells me it's secure. And I'll go ahead and remove the old ties. When I'm doing that, I have to hold the trach and just to make sure everything is secure. And okay, then I'll go ahead and make sure the tube is on the right, the inner cannula is on the right place, and I also make sure the new tie that I'm putting has two or three space between the tie and the patient neck. And then I have my sterile 4x4 glove, and I'll go ahead and place it around the stoma or the trach. Just want to make sure it's smooth. Okay. And make sure the tie is secure, just that case it won't come out. Okay, then I'll go ahead and dispose all the materials that I used. This is the sterile glove I had. I can go ahead and dispose my disposable glove, or I can go ahead and clean everything that I used. Okay, now before I go ahead and finish, before and after, I have to assess the vital signs like the heart rate, the breath sound, the saturation, the SAT and the capnography, and all that, the breath sound all the same time. So just to make sure everything is good, and I'll go ahead and confirm the stabilizations of the tube. If it's necessary, I can go ahead and order a chest x-ray just to make sure if it's the right place, and if there's any needs for suctioning, I'll go ahead and assess that also. And at the end, I'll go ahead and provide a speaking valve for the patients. There are two speaking valves. The first one is Passy-Mary speaking valve and fenestration tracheostomy care. So every time we do this procedure has to be in 24 hours, or every shift needs to be done. Every shift needs to be done. So this is how you demonstrate tracheostomy care. And thank you for watching.